following interview involves commercial content. The products and services featured appear as paid advertising.
Well, you may have decided to improve your vision and overall quality of life with laser eye surgery or LASIK. But before you take the plunge, you have one final decision: selecting the right LASIK surgeon for you. This is one of the most important healthcare decisions that you'll ever make, and you should consider several factors. Dr. John Dishler is a LASIK pioneer, nationally recognized, there he is, as an inventor and innovator of LASIK technology. Dr. Dishler is the first in Colorado to perform LASIK, developed an FDA-approved laser, and founder of the all-laser method. He's the recipient of awards and recognized for his contributions and advancement in LASIK. Now, he's here with Marc, a test engineer who had LASIK earlier this year. After years of encouragement from coworkers, he chose to go with Dishler LASIK. That's good news.
That's
Welcome
correct.
to the show.
Thank you. Thank you, Denise.
So, Dr. Dishler, not all LASIK eye surgeons and centers and LASIK eye surgeons are equal. So kind of help us with determining why LASIK is the best suit for certain people out there.
Well, it's really hard for people to know exactly where to go, but I got a few tips for you. One thing, look for a reputable center, and when you first go in there, they should be friendly, they should greet you, it should be organized, tidy, clean. They should offer the latest equipment. 100% all laser seems to be kind of the standard now. And they should have a really friendly staff. They should know your name. You should get to meet the doctor if you want to, get all your questions asked, feel really comfortable that you're, people should say, wow, I really feel good about choosing this place. And that's just like any decision, that's true. That's the thing you need to do.
You got to do your research. And Marc, you did your research. So tell me the factors that you considered when choosing Dr. Dishler and LASIK altogether.
Yes, over the past 10 years, I was asking friends and talked to some co-workers where I work at, and they both had the surgery done with Dr. Dishler, and they said he was the best LASIK surgeon in town. And so I'm particular about my eyes, and so that made me feel comfortable. I went in for a consultation, and it was just so great. The staff is great, and they just made me feel at ease. And I was a candidate. That was the big thing. I was worried about if I was a candidate or not.
And what were the motivating factors? I mean, how were you struggling with your eyesight?
I had contact lenses, and anybody that wears contact lenses knows all of the issues with those, from getting dislodged or displaced when you're going swimming or anything like that. And I just got tired of having contacts and wanted to just go with clear vision without any contacts, or corrective vision with glasses.
And besides, being able to go swimming without contacts, how has it increased your life? It made your life better?
Oh, yes. I have a buddy at work. We go walking to our lunch breaks, and it's just so much nicer to be able to walk without having glasses on and enjoy the view from where I work at. And I can't tell you enough. It's just great. It's changed my life.
And the first time you opened up your eyes and you could see the alarm clock, wasn't that cool feeling?
Yes. No more blurred vision. No more with dry contacts. I did wear the extendeds, and even with those, they're dry, and you have blurred vision in the morning until you put some eye drops in, and don't have to worry about that anymore.
Dr. Dishler, that has to make you feel good what Marc said, that when he was considering, what doctor?
He gave me a hug when I first came in. That's
really?
What really made me feel good, yeah.
Hey, he better be sending you a Christmas card too. So doesn't that make you feel good, though, when he was told by other people, Dr. John Dishler is the best doctor out there? Obviously, you're doing something right with your patients.
Well, what can I say? I mean, that's great to hear. There's nothing better than word-of-mouth referrals from other patients or doctors. That just makes us feel so good that people choose us based on that.
And what are your secrets to encourage people saying, hey, I made the right decision with this doctor?
Well, we're developing tomorrow's technologies today, and we're involved in research. We have students, and we're very dedicated to giving people the very best care that they can possibly get. We give them honest opinions. Marc's wife, she came in, and unfortunately she wasn't a candidate, but we were really upfront and told her that. Because the trick is to only do people that, can really benefit from this, and most can, but a few can't. We also are one of the few places that we're in a licensed ambulatory surgery center, ASC, so patient safety is paramount for us, and we put that first, and we make people both feel comfortable but also very safe.
Obviously, positive and honest endorsements and honest education too. Like you said, some people are right, some people are not a good fit for LASIK. How do they know it's time? I need to take the jump to go to LASIK.
Well, it's got to be something that somebody wants to do. And so they have to have realistic expectations. They need to understand if they're over 40, they might still need reading glasses. And they have to weigh the benefits and the risks. For most people, the benefits far outweigh the risks, but the risks are something that with any procedure you need to consider. And after getting all that information and learning about our center, we give everyone a tour where they can actually see the lasers. And we go into things in much greater depth than just, are you going to be 20/20 or not? We expect everybody, just about everybody, to come out 20/20 or close to it, but there's a lot more to it than just that.
303-793-3000 is the number to call and see if this is right for you. Now, you said his wife was not a candidate. How do you know, how does someone know, okay, this isn't going to be right for me?
Well, there's a lot of different reasons why people might not be a candidate. You have to be at least 18 years of age. That I don't think was an issue for his wife. But some people have prescription changes. Some people have some kind of eye disease. But mostly if the corneas are thin or the pupils are too large or there's bad dry eyes or some other factor in the eye exam that we kind of find out when we're checking out people, those are the types of things that make people not a good candidate. Some people are candidates for other procedures like PRK instead of LASIK. But there's certainly people that just won't benefit from having any kind of refractive surgery, and it's important to know going into this whether you're a good candidate or not.
And is it as easy as picking up the phone and calling you to make an appointment to find out and becoming a good candidate?
It's just that easy.
Really?
Call up and get an appointment. We have a lot of technicians, nurses. We have a large facility, and we can accommodate people on just about any schedule. That we see people now over their lunch hours. We have hours that are just tailored to people's needs. We have people on call 24/7, so we're there for you.
I really like in the past, and Mark, maybe you could tell me this too, there's been past patients on the show that said somebody was there to even hold their hand when they were nervous during the procedure. Is that true?
Yes, that's a good segue. I would like to give thanks to Dr. Megan Petraeus, optometrist there, and Rachel. She's the prep nurse. She made me feel very comfortable there before the surgery, and Dana, the patient counselor there. Just a wonderful experience. I mean, the whole time it was great. What's even better is that Dr. Dishler performs all the surgeries. I wasn't aware of that. So it's, you have the pioneer doing the surgery for you as well.
Excellent.
That's
Yeah.
right.
You're always safe with Dr. Dishler.
That's
now,
right.
you had a very interesting chart that you want to show us. It's very psychedelic,
If you got a second, let me dazzle. I just found this. Let me dazzle you with this chart here.
Whoa.
See that picture? Now, here's the question. Here's the trick question of the day. Which is clearer, the top or the bottom of this?
Now, I would say the top.
Yeah, everyone would say the top, right?
Right.
And that's the thing that's really great, because the truth is they're both just as sharp. They both have the same resolution, but yet the top seems clearer because we as humans have a thing called acutance. And acutance means that we're sensitive to contrast, and the top's got better contrast
Darker.
than the bottom, but they're both just as clear. And why that's important with LASIK is it's not, these both are 20/20, but the difference is that if you maintain the contrast, if you reshape the eye in the right way, you give people that pop in their vision that makes them so happy.
Interesting.
And so it's not just about eye charts and things like that. And it's that sort of understanding that helps us to make people happy.
And Mark, how are those walks these days with your buddies at work?
Oh, they're great. It's spectacular. We have a nice area, the walk on campus, and it's perfect.
Well, thanks for sharing your story.
Thank you.
Congratulations. Now, by choosing Dr. Dishler, you'll receive a high standard of care at the very best value and a local surgeon who you definitely can trust. After all, your eyes deserve the very, very best. Dishler Laser Institute is offering an exclusive Colorado & Company special. Schedule your surgery by April 30th, and you'll save $300 off Dr. John Dishler's lowest guaranteed price for custom all-laser LASIK. Your consultation is free, and special financing is available. Some restrictions do apply, including credit approval. Call 303-793-3000 for further details, or visit Dishler.com for more information. And the Dishler Laser Institute paid for this segment.